2 centimeters in diameter. So kung very short ang umbilical cord ni baby, hindi po siya masyadong kumbaga makaswim inside the womb of the mom. Kasi hihilain siya ng kanyang cord. Oops, huwag masyadong malikot. Kasi konti lang yung ating cord. Okay. Masama naman din kung more than 90 centimeters, it is because very risky yan siya. Pwede yan siya magkaroon ng coil. Like for example, neck coiling, yung sa paa niya, sa kamay niya, pwedeng mag-twist-twist ang cord dyan that it can cause decapitation, yung mapuputol or mawawalan na ng buhay yung kanyang cord. Kasi pag na-twist yan sa kamay, walang circulation yung kamay niya, mamamatay ang mga cells doon. So, pungkol si baby, inigawas. So, disable na. So, it contains 2 arteries and 1 vein. Dalawang arteries po, which contains less oxygenated blood. Okay? And 1 vein, that is an oxygenated blood coming from the placenta, going to the baby. Ang arteries naman, nagdadala yan siya ng low oxygen na blood from the baby going to the placenta for oxygenation. All right? So, 2 arteries carry blood from the uterus to the placenta. 1 vein returns blood and nutrients to the fetus. So, isa lang po na vein ang nagdadala ng oxygenated blood as well as the nutrients for the baby to grow. All right? Then, the umbilical cord is normally inserted at the center of the placenta. Nasa gitna talaga siya ng placenta, guys. Hindi pwedeng nasa side kasi madideplete yung kanyang supplement towards the fetus. So, normally, nasa gitna. But there is what we call abnormality na nasa dulo talaga siya ng placenta. No? And it is, the baby would be put to risk yun. No? If the umbilical cord is situated at the end, sa dulo na ng placenta. Okay? The cord also contains a clear jelly-like substance called our Wharton jelly. Okay? Which is a connective tissue that prevents compression of the blood vessels. That is why when the baby is born, when you take hold of the cord, it is very, very, very slippery. No, murag siya na isipon. So those are the secretions of our Wharton jelly. No? Now, which protects the 3 blood vessels inside the cord. No? Kasi kung wala si Wharton's jelly, easily compressed yung mga blood vessels natin doon sa umbilical cord. So, this might cause some deficiency ng nutrients that should be given to the fetus. What if yung vein talaga ang na-compress? So, walang supplement si baby, walang growth na mangyayari. Pwede pang mamatay si baby. No? Okay? Yan. Then we go now, or we have to talk about multiple pregnancy. So, approximately 2% of birth in the US are multiple. Okay? Nasa genes kasi yan nila. Mostly, it involves twins. Triplets occur in 1 to 7,600 pregnancies. Multiple births higher than triplets are rare. Mga quadruplets, quintuplets, sextuplets, septuplets, meron din kanya octets, diba? But the incidence is rising due to the increasing use of gonadotropins to treat women with ovulatory failure. Etong gonadotropins na ito, guys, ito yung tinatawag na fertility, no? Fertility, ibig sabihin yung iyong ovary would constantly develop 1 or more, mature ovum. Okay? Yan, fertility pills na napugos ang imong ovary to produce those. Lalo na sa mga women na irregular. No? Na hindi mabuntis-buntis. So, they opt to take fertility pills. So, it so happen na overproduction na. This can also result to multiple pregnancy. Iba naman din yung it is namana mo. Like for example, ang iyong lolo at lola may lahi silang twins pero walang nagmana sa kanilang mga anak. Okay, sa inyong mga parents walang nagmana. Pero sa inyong generation, because you are the third generation, lalabas na po ang twins. Okay, lalabas na. If you have a genetic predisposition to multiple pregnancy, lalabas at lalabas yan usually sa third generation. Pag kayo nagkaroon ng twin, definitely, ang anak ng inyong twin, sila na naman yung magmamanifest ng triplets or multiple gestation. Nakuha? Ay, mali. Nasobraan. Okay. So, there is two types of twins. All right? Likot kay kung kamot ba? Okay. We have first the dizygotic or the fraternal twins. Okay? It is a multiple pregnancy which involves two or more ova fertilized by separate sperm. Fetuses have separate placentas, amnions, and chorions, although the placenta may fuse to resemble a single one and may be the same or different sexes. As you can see, kasi dalawang egg, magka-separate sila na na-fertilize ng dalawang sperm. Okay? What if during the taking of your fertility pills, duha, both the right and the left ovary produces mature ovum. So, timing na nag-sexual intercourse ang couple. So, mabilis yan. Mabilis ang takbo ng sperm, no? Because of their flagella, yung tail nila. So, most probably, no, andyan na yung ovum, mag-fertilize siya ngayon. Kasi pag ganyan yung ating fallopian tube or our oviduct, right? Duhapod siya. So, duhapod ang ovary. Pag nagsabayan siya ng putok, ibig sabihin, hindi puputok ang ovary ha. Yung mag-release lang siya ng egg. Alright? Kung sabay sila, sabay din yan mag-fertilize. Usually, this happens or this would result to dizygotic fraternal twins. As you can see the picture, yung dalawang yellow sa baba. So that would really show, no, na to better understand why ing-ani ang gawas. As you can see in the first picture, Amerikana, kaayo ang isa. Pero yung isa katabi niya, which is her fraternal twin, no, iba ang itsura niya. No, 'di ba? But they are twins. Kagaya lang gud diyan nung yung movie na yon na si Arnold Schwarzenegger tsaka yung si De Vito, no? They are fraternal twins. Isa pandak, isa yung malaki, no, 'di ba? Yung sa mga bukid-bukid natin, no, hindi nila alam na ang kambal dalawang klase yan. So first is the dizygotic or the fraternal twins. The other one would be your identical twins. Okay? Monozygotic, identical twins. Ito, ang babae at lalaki na twins are fraternal twins. Hindi sila pwedeng maging identical. As you can see, sa sex pa lang, magkaiba na yung sex nila. So bakit sila tawaging identical twins? Right? Oh. So even though their features is very close with each other, no? Kasi magkapatid nga sila. Nakuha nila both blue eyes, pero different ang sex nila. So they are considered as fraternal twins. Kasi madidepict mo yung meaning ng identical. Okay? Yun ang ibig kong sabihin, guys, no? So we go now to the second type of twin, which is the monozygotic or identical twins. So this is a multiple pregnancy which develops from a single fertilized ovum. So isang itlog lang po siya na fertilized ng isang sperm, nag-split siya into two, no? Kaya siya identical twins. No, fetuses share a common placenta and chorion but have separate amnions. No, they are the same sex and have the same genotype. As you can see in the picture, guys, no? Oh, konting diferensya lang ang twins, no? Na identical twins, 'di ba? As you can see here, no? Two sets of twins. Okay? So, isa lang po yung placenta nila pag identical. Pag fraternal, dalawa po ang placenta. Nag-ija-ija silang balay. Kasi sperm contains different genes. No? Different ang genes na mamamana ng per person. Alright? Pero ito, isa lang po. So, there is also a slight difference lang. Okay? Yan. So, we go now to the fetal development. So, the first 14 days, tawagin natin siya na zygote or balot na fertilized ovum na siya. No? First 14 days. Then, you call that that balot as an embryo if it is already on its 3rd to 8th week of pregnancy. So, 2 months. So, at 2 months of pregnancy, the baby would look this way. Unsay dagway niya sa tanaw ninyo, guys? No? Ing-ani pa yang dagway. Then, when it past 2 months until birth, it is already called as a fetus. Alright? Zygote muna, tapos naging embryo, then fetus. Do not mistake to call the zygote as embryo. Alright? Pag sinabi mong zygote, fertilized ovum yan siya, it looks this way. Magyapon siya itlog, balot. Okay? Then, it turns into an embryo after 2 months or in 2 months' time. Ani na yung itsura. Okay? Then, fetus na from 2 months to birth. Alright? Okay. Let's go now to the focus of fetal development. Okay. The focus of fetal development, particularly in the first trimester of pregnancy, is organogenesis. That is why it is very risky for the mother who is in the first trimester of pregnancy. Tanong kayo, ano man yung first trimester of pregnancy, ma'am? It is the first month to the 3rd month of pregnancy. That is your first trimester. So dito nangyayari yung development ng mga organs, paano na-form yung baby, no? Pag merong nangyari or na-expose si mama on the first trimester of pregnancy to teratogens, like hindi niya alam, buntis pala siya, nagpa-x-ray ka ron. So there would be a defect on the development of the baby. Alright? So bawal po ang radiation. Even yung mga who is a drug addict, frequently smoking, drinking. So there is an effect on the growing baby inside the womb. Bakit ang smoking? Why? Because the content of the cigarette, which is nicotine, vasoconstricts all the blood vessels in the body of the mother. That is why kung vasoconstricted ang blood vessels mo, how can you supply enough nutrients and blood to the growing baby inside the womb? Alright? So there would be a problem in that particular case. Okay? Then a member of the family is smoking. You are not smoking. So you become a passive smoker. You inhale what has been expelled by your partner. So you also is a smoker. Passive one lang. Inhale ka lang ng inhale. Pero the effect is the same. That is why we are always teaching the mother, if the husband is smoking, it should be done outside of the house. Okay? Hindi pwede sa loob ng bahay na nai-inhale ng buntis. So, at risk si mother niyan. Okay, because of the growing fetus inside the womb, this growing fetus becomes like a parasite, no? Sa mother. That is why I'm always saying, ang buntis is immunocompromised. Why? The baby is constantly getting all the nutrients that you have that is coming from the food that you have eaten, and then she is or the baby is consuming it, getting it, kasi gusto ni baby lumaki. Then here you are. Ikaw ngayon ang masakitin and everything. Okay? So yan. So sa second trimester and the third trimester of pregnancy, dito na makikita ngayon yung period of growth and development. Okay? Sa second trimester, padahan-dahan pa yan. No? 4, 5, 6. 4th month to 6th month of pregnancy yan. So dahan-dahan po yan, nag-grow si baby. On 5th month, pwede na natin magpa-ultrasound for sex determination. Very excited. Huwag lang talaga sa 3 or 4 months kasi baby, iyan ang itago. Mag-fetal position na siya, magtutuyok sa uterus ni mama na hindi mo makikita ang sex. So the perfect month to have sex determination would be on the 5th month of pregnancy. Coupled with that, mag-ampo pa jud ta. Nga dili taguon ni baby sa iyang tiil ang iyahang organ. So, sometimes man good, iyahan ang taguan ang iyang organ. Siguro nakikinahagoy, schedule ko ni mama ron sex determination kay nadunggan ni baby ang conversation sa parents, no? So, iyahan ang lukuton niyahang organ niyang taguon. Malas na lang, mahal ba yan, no? Okay? So, the third trimester runs from the 7th month to the 9th month of pregnancy. So, dito, ginadiet na si mother, guys. Kay the more you eat, the more the baby grows. So, mahihirapan ang mother natin na manganak normally. Okay, why? Because the baby can no longer fit in the pelvic cavity kaysa sobra niya kadako. So, what will be the resultant effect of that one? Agoy, cesarean section, which is way too expensive on the part of an ordinary couple. Alright? So, yan ang tandaan natin ha. First trimester, bawal ma-expose sa mga teratogens. Actually, hindi lang man talaga first trimester, the entire pregnancy period, guys. Ang first trimester lang ang very critical. Bawal sex. Bawal sex between couples. Bawal ma-expose sa mga teratogens. So maybe later on, we will discuss on what are those teratogens that can cause genetic abnormalities sa babies. Okay? Lalo na pag itong first trimester talaga. Okay? Sa second trimester, okay pa, no? Kasi ang baby natin buo na. So later on, every month, makikita natin ngayon ang development ni baby inside the womb. Okay? Then the third trimester of pregnancy, ito, period of most rapid growth and development. At this stage, mother, dahan-dahan. Ang 4 na bibingka, gawin na lang natin 2 bibingka. Alright? Kasi ang mga buntis, kung hindi sila marunong mag-diet, no, ang lahat ng food nag-sparkle sa paningin nila. Gusto nilang ubusin lahat. Lamon kay lamon. No? It's because nagakutoy ang ilahang tiyan. They feel very hungry every now and then. That is why ang obstetrician natin nag-a-advise sa mother na to eat 6 small meals lang. Small meals, no, a day. Hindi pwede isang bandihadong kanin, ubusin mo agad. Why? Your belly is growing, your stomach is pushed up, so you have the tendency to vomit excess food in your stomach. So, pangit din kung mag-vomit si mother. Why? Kasi kung mag-vomit ka, saan ang pressure? Diba sa abdomen? Ayaw natin magkaroon ng pressure ang abdomen ni mother. Why? Because you are stimulating the uterus to contract. That is why it is very difficult for a pregnant mom, no, to have diarrhea or loose bowel movement during pregnancy. Why? Because your GI is posteriorly located sa ating reproductive system. So kung magsikik peristaltic movement, kay gidiarrhea si mama, kay nagkaon lagi street food na. Okay? So you are tickling the uterus, which is located anteriorly sa GI. So ano ang mangyayari niyan? Mag-contract ngayon. So there is what we call premature labor na, no, ang mother. So, bawal magkasakit talaga during pregnancy. So, mga puntis, always namin yan gina-advise. Ayaw sige glaag, do not go to the mall that is very dirty. Okay, sana yan. Kung nasa park ka lang, sige mag-park. Kay dili gyud. Kay gusto gyud dito sa mall. No? Yan. Respiratory problem. The more. Why? Pag respiratory problem natin, mahirapan din ang buntis. Why? Because the diaphragm is pushed up by the growing uterus. So, ang diaphragm natin is a space wherein to give room for our lungs to expand. Right? So, ni gamay man ang diaphragm na to, halos nipilit na sa atuang xiphoid ang diaphragm kay buntis ta. O, ano nangyayari ngayon? Hindi masyado makahinga si mama. Okay? Unya, nagkaroon pa ng respiratory problem. Aduy. Okay, kalbaryo on the side of the mom. So, any illness can put the mother at risk for any risk in pregnancy such as prematurity. Okay, so bawal magkasakit ang mama. Okay, let's go now. Let's proceed to the milestones of fetal development. So here I have enumerated, no? In the 4 weeks or 1 month of pregnancy, ing ani kadako si baby, daw butiki, no? So the embryo is 4 to 5 millimeters in length. So our trophoblast embed in the decidua at this moment. That within, ano man yan siya guys, no? Ano ang nangyayari within the month? So mag-start ka talaga sa trophoblast, no? Even if it's for 1 day, 2 days pa, no, ng implantation. So i-consider talaga natin siya as a whole month of development. Okay, then in here also chorionic villi form. So foundations of the nervous system, genitourinary system, skin, bones, and lungs are formed. First month pa lang yan guys, ha? Buds of arms and legs begin to form, like this one, oh, na. Then rudiments of the eyes, ears, and nose appear. Na siya mata. Alright? So, pagdating ng 8 weeks or 2 months, ing-ani na siya. Muna siya kuba, pero ana dyan na siya. Kaya ang iyahang mga, what you call this one, circulatory system, no? So, the fetus is 27 to 31 millimeter in length. No, and weighs 2 to 4 grams lang po. So, gamatiting pa kaayo si baby. Then, fetus is markedly bent. As you can see, mura siyang kuba. Okay? Murag tadpole, no? Head is disproportionately large as a result of brain development. Okay, at first, yun, mudako dyan ng ulo sa bata. Kaya siyempre, yung circulatory and nervous system, no? Sex differentiation begins, no? At this particular month, okay? Centers of bone begin to ossify. So, mugahi siya. Okay? Then, 9 to 12 weeks, about 3 months, the fetus average length is 50 to 87 millimeters and weighs around 45 grams. Okay, fingers and toes are distinct already. Makikita mo talaga na hiwalay na yung mga toes niya, hiwalay na yung mga fingers niya. Then the placenta is already complete. So it can function na on its own. Then rudimentary kidneys secrete urine. Mauna, mong ihi, sige lang ihi ng baby sa sulod. Kaya sige man po siyang inom o amniotic fluid. So sige po siyang ihi. No? Then fetal circulation is complete already. As you can see in the picture, very prominent yung ating dalawang artery at isang vein dito sa kanyang umbilical cord. Then external genitalia show definite characteristics na. Okay? Then we go now to the 13 to 16 weeks, about 4 months. 4 months na siya. So beginning na siya ng kanyang second trimester of pregnancy. So the fetus is 94 to 140 millimeters in length and weighs 97 to 200 grams na. Head is erect already. So very prominent na po yung grow ng abdomen ni mama. So lower limbs are well developed. Coordinated limb movements are present. So twitch na siya. So at this particular month, makaka-feel ang mother ng somehow pitik-pitik sa kanyang tiyan. So those are slight movement ng baby. Okay? Then heartbeat is already present. Lanugo develops. Yung fine downy hair ng baby, no? May buhok, no? Sa all over particularly sa neck area and the body of the baby, hair grows. Nasal septum and palate close. Supposedly at 4 months, this particular structure should close, or else it will remain open until the baby is born. Okay? Then fingerprints are set. So may sarili na siyang identification. Okay? Yan. Then how about sa 5 months? So the fetus in here is already 150 to 190 millimeters in length and weighs approximately 260 to 460 grams. So lanugo now covers the entire body. So very hairy si baby at this particular time. Fetal movements are felt by the woman. No? Yung kick ng baby, yung galaw ni baby. Nagsiswimming na sa loob ng tiyan. Eyebrows and scalp hair are present already. Then heart sounds are perceptible by auscultation. So definitely, kung tayo magjo-duty sa DR, we do not use stethoscope pag 5 months pa po ang pagbubuntis ni mama. So, ang ginagamit po natin is yung Doppler ultrasound. Okay? Yung parang meron siyang probe na nilalagyan natin ng gel on top. No? I will show you when we discuss the intrapart tube. Okay? Then, ilalagay sa tiyan ni mama. So, you can definitely hear the heartbeat of the baby without applying much pressure sa kanyang abdomen. Kasi bakit? When we take a heartbeat ng baby through the use of our stethoscope, we definitely should apply pressure, sa abdomen for us to really hear the heartbeat of the baby. Coupled with that, ang isang kamay natin nakalagay sa other side, then ang isa nakalagay doon. Ang bell doon sa where you should hear the fetal heartbeat. Okay? Vernix caseosa covers the skin. So this vernix caseosa is the cheesy-like secretions that is, seen all throughout the body of the baby. This would serve as a heat regulator po sa baby. Okay? This can add up to the warmness of the baby. Sometimes nga, pag pinanganak yung baby with a lot of vernix caseosa, the baby is far from experiencing hypothermia. All right? So, if you see the baby is born with those cheesy, murag paste, nagdikit-dikit sa katawan niya, do not wipe it off. Yak man, uyaki man ka ay ma'am. Uyaki sa imuha, but the baby is protected by that one. Okay? The baby will be kept warm through that. Kasi mawawala lang po yan siya when the baby regains her own normal temperature. Matutunaw lang po niyan. Pag natunaw yan siya, that would serve as a moisturizer sa skin ng baby. So makita mo yung baby, ibang baby, hindi siya nagde-desquamate or nagpipeel off ng skin. No? Kasi sometimes yung baby na walang vernix caseosa, guys, very dry yung skin upon the exposure sa environment, Nagda-dry ang skin niya tapos nagbabalat-balat. But if the baby is madami siyang vernix caseosa, so by the time na mainit na si baby, nag-acquire na ng normal temperature, so madidissolve or matutunaw lang po yung vernix and it would moisturize the skin of the baby. Kaya hindi siya mag-desquamate. Okay. So 21 to 25 weeks, 6 months and 1 week old ang baby dito. The fetus is about 200 to 240 millimeters in length and weighs around 495 to 910 grams. As you can see, ito na po yung weigh ni baby sa loob ng tiyan mo. Hindi pa kasali ang amniotic fluid na weight, hindi pa kasali ang weight ng placenta. So mabigat na po siya. Okay, at 6 months. Skin appears wrinkled and pink to red. Rapid eye movement begins. Eyebrows and fingernails develop. Sometimes, if you wanted to see more than 6 months old na baby, mag-YouTube kayo. Sometimes, malahaba na yung kanilang mga kuko. So, sustained weight gain occurs at this particular month. So now we go now to the 26 to 29 weeks. Around 7 months and 1 week old ang baby. So the fetus is 250 to 275 millimeters in length and weighs about 910 to 1,500 grams. So kilo na siya, guys, 1.5. So skin is already red. Rhythmic breathing movements occur. Pupillary membrane disappears from eyes. The fetus often survives if born prematurely. As you can see in the picture, no? Tao naman jud ni, no? Pero premature pa siya kasi ang mature newborn natin is born around 9 months. Okay? So pag hindi pa siya umabot ng 38 to 42 weeks, ibig sabihin, the baby will be considered as premature. So at this stage, the baby can survive at 7 months, but she is considered as premature. Okay? Then we go now to 30 to 34 weeks, about around 8 months and 2 weeks old. So the fetus here is 280 to 320 millimeter in length and weighs around 1.7 to 2.5 kilos. Okay, toenails become visible. Then eyelids open. Uy, nag-blink, nagpurap-purap na ang mata ni baby, no? As the baby would open the eyes, no? Doon. Sa loob ng tummy ni mama, no? Okay, then steady weight gain occurs, vigorous fetal movement occurs. Okay, so nag-swimming, nag-jumping horse na si baby, no? Close na siya para maglabas. Alright, so as you can see, hindi lang po lahat naka-close yung mata ni baby. No, at this particular moment, the baby can open her its eyes, no? To the surrounding, even if may amniotic fluid. Okay? Then we go now to 35 to 37 weeks, about 9 months and 1 week old. So the fetus average length is 330 to 360 millimeter. Weight is about 2,700 to 3,400 grams. Face and body have a loose, wrinkled appearance because of subcutaneous fat deposit. Body is usually plump and lanugo disappears. So yung fine downy hair natin, usually it disappears around 9 months, no? But sometimes the baby is born with lanugo still, no? Lalo na dito sa shoulder area niya at saka dito sa kanyang jaw banda. Okay? Then, nails reach fingertip edge, amniotic fluid decreases na. So, yan. Ayan. At around 38 weeks to 42 weeks, full term na po si baby. So, ready na siya sa labas. Okay? So, the average fetus is 360 millimeter in length and weighs around 3.4 to 3.6 kilos. Okay? Skin is very smooth already. Chest is prominent. Eyes are uniformly slate colored, and bones of skull are ossified and nearly together at sutures. So, pwede na siya mag-fuse. But definitely, hindi pa siya pwedeng mag-fuse kasi lalabas po siya. Okay? Testes are in the scrotum na. That is why when the baby is born, we should always assess kung ang testicles ba niya bumaba o hindi. Okay? Kasi it is a risk for the testicles not to go down. Kasi ang baby is magiging infertile. Okay? Kasi doon na kumukuha ng similya, di ba? Sa testicles ng lalaki. So now, we would go to the common teratogens and their effect. So what is teratology? It is the study of abnormal development in embryos and the causes of congenital malformations or birth defects. So these anatomical or structural abnormalities are present at birth, although they may not be diagnosed until later in life because some of the teratogens would take effect later. No? Hindi mo makikita yan sa itsura ng bata, but when they begin to talk, read, dun mo na nakikita, ay, eto pala yung defect niya. Okay? They may be visible on the surface of the body or internal to the viscera. Okay. Okay, normal siya dito, pero yung palang defect niya is doon sa loob ng kanyang katawan. So congenital malformations account for approximately 20% of deaths in the perinatal period. Approximately 3% of newborn infants will have major malformations and another 3% will have malformation detected later in life. Okay? So this is what you call teratology, the study of the abnormality caused by teratogens. Okay? So what are these teratogens? That can cause harmful effects or causes somehow congenital abnormality sa ating mga babies sa loob ng tiyan. So these are drugs, chemicals that the mother is exposed to, or even infections that can cause abnormal fetal development. Okay? There are billions of potential teratogens, but only a few agents are proven to have teratogenic effects. Kaya tinitingnan natin, yan ang importansya ng pregnancy category in every drug, no? Na makikita nyo. Pregnancy category X, ayaw dyan na. Pregnancy category CBA. Okay? Meron pong ibig sabihin yan. So you come to know about that when you are done with your pharmacology concept. Okay? So, okay. So these effects can result in the baby being born with birth defect. So ito, pinapalibutan ako siya og mga teratogens. Okay? Mga buntis, marami talagang bawal. No matter how mild, no, the drug is, the buntis should not take it. Kasi lahat ng drugs po, even mild biogesic, has its side effect sa buntis. Unless the doctor would advise you to take this because grabe ang headache mo, but the doctor cannot give you strong analgesic because it has an effect on the pregnancy. Okay? So, hindi pwede gamay, sakit ulo lang, kay kulang katulog, ganday ka biogesic. No. The doctor would advise you to rest and sleep if that is the cause of the headache. No, the doctor cannot give you right away medications, lalo na pag buntis ka. Alright? Kasi nga yan, number one yun nakalagahala. Ano nangyari? Number one yun nakalagay is drugs. Diba? Sometimes naman tayo sa chemicals. Chemicals like yung mga buntis na nagpapa-rebond. Bawal po yan. Nagpapakulay ng hair. Bawal din po yan. Kasi chemicals. Alright? Bawal po magpaganda ang buntis. Maganda na siya. Kasi babae talaga siya. It's because buntis siya. Okay? Oh, di ba? Okay. So, let's go now to smoking. Yung cigarette, na sinasabi ko a while ago. Kasi yung cigarette natin contains nicotine which constricts, no? Uterine blood vessels. Lalo na pag buntis ka na. Buntis na yung mother. And then, she keeps on smoking. So, that can give her a baby which has a defect later on. Kasi nga, dinideplete niya yung nutrients and blood going to the fetus. So, the baby might be small for its age. Small for gestational age ang baby. Kasi kulang nga ang supply sa kanya. And later on, malalaman natin na meron palang slowed mental development yung baby. Kunya, tawagon pa dyan mo siyang bugo. Kinsa may bugo ron? Ang mama, kasi siya sigarilyo. Ang problema is, kailangan talaga ma-educate ang community with regards to pregnancy and ang effect niyan when exposed to teratogens. Okay? Mga lack of knowledge ang mga tao. No? Sometimes, may knowledge ka, pero gustong-gusto mo gawin ang bawal. Wala na tayong magawa dyan. It is the choice of the mom. So whatever whatever will be the result of the pregnancy, problema na yan ng mother because you are not lacking in giving her education with regards to the effect of these teratogens. No? Yeah. Then let's go to alcohol. Akala natin, ay ma'am, karon lang bitaw gabi ma'am, pwede ko mag-inom ma'am kay birthday bakit sa kong kuya. Dili lagi. Bawal. Okay? Lalo na pag buntis ka. No? Alcohol is a common drug abused by women of childbearing age. Okay? Akala nila juice, okay lang, comparable to juice ang alcohol. But it can give a teratogenic effect on the unborn baby. That is why, di yun, maski tilaw, maski sip, dili, pwede. Hatagig, iced tea. Ang buntis. Okay? Ayaw lang jud alcohol. So infants born to alcoholic mothers demonstrate prenatal and postnatal growth deficiency. Why swerte mental retardation ang gawa sa baby and other sorts of malformations. There are subtle but classical facial features associated with fetal alcohol syndrome. No? Mura pog hubog ang baby, inig katawo niya, no? A baby that is born of an alcoholic mother, ang baby tan-aw nimo ang itsura gani, mura jud pog hubog. No, mapungay ang mata, no? Parang si Garfield ang mata niya, no? Yan yung FAS. Tinatawag na FAS, no? Fetal alcohol syndrome. No, yan yung mga features niya. Short palpebral fissures, maxillary hypoplasia, murag na ana, nalumping ang nawong, and congenital heart disease. Would you want your unborn baby to develop congenital heart disease? May pangwala na lang ni mo buhian na. Kasi when the baby grows, it would experience really difficulty. Okay? Mahirapan talaga si baby mag-grow. Okay? And there are a lot of effect, no? Yan, tingnan nyo. Even moderate alcohol consumption consisting of 2 to 3 ounce. What you got 2 to 3 ounce? Gamay raman na siya. 1 ounce is equivalent to 30 cc. No? So, ibig sabihin, pag umabot ka ng 3 ounce, that is 90 cc already. So, over na siya kaayo. Okay? Of hardly cup per day may produce the fetal alcohol effects. Okay? Binge drinking also likely has a harmful effect on embryonic brain developments at all times of gestation. So, kung maghangyo ang buntis, sige na ma'am, gamay ramang kaayo. Dili jud ka mo give in. Okay? Kay ingnon jud mo ma'am, maski unsa ka gamay, maski isa ka kutsara ra na ma'am, di gud pwede. Okay? Mao jud na ang imong iingon. Dili jud ka, oh tama, pwede raman jud siguro. Na, utrusad ka. Okay? Sige. Next would be tetracycline. So this is a type of antibiotic. It can cross the placental membrane and is deposited in the embryo in bones and teeth. Can you just imagine ang mama nag-inom og tetracycline antibiotic because it's an antibiotic, it can protect you, no? I-treat sa tetracycline, so matitreat ka, pero ang baby would manifest something. Like for example, no? Yellow staining of the primary or deciduous teeth and diminished growth of the long bones. Gusto ka mahimong punggok imong baby? Kay di ba ang long bones mo, asa man na siya, di ba sa imuhang legs na siya? Oh, nahimong putot imong baby because the mother is exposed to tetracycline antibiotics. Okay? And of course, coupled with that, those anticonvulsant agents such as your Phenytoin. If the mother has a what you call seizure problem, ito man talaga yung binibigay. So, if the mother got pregnant during its medication, no, to treat the seizure, so more or less the mother would, kung nasa labas tayo guys, the mother would be advised for abortion. Pero kung dito sa Pilipinas ito guys, okay? Di mahadlok man jud ta. Mahadlok tas gaba no. So dili gyud nato ipatanggal si baby kay abortion man bawal man yan, no? So we can have a baby that has a problem. Okay? So pwede din yan ma-stunt ang growth ni baby inside the womb, no? Magkakaroon ka ng microcephaly, mental retardation, okay? And some other features that is stated here. So, bawal jud. Madaming bawal sa buntis. Lalo na pag anti-cancer drugs or your chemotherapeutic agents, no? Are highly teratogenic as these agents inhibit rapidly dividing cells. Akala nyo ba cancer cells lang namamatay when a woman or a patient with cancer, no, would undergo treatment such as chemotherapy? Pati imong healthy cells iyang patyunsan. So, yun. Kaya siya naging teratogenic, guys. Kasi developing yung fetus inside the womb, unya wa kay mahatag sa iya, kay nangamatay naman tanan, no? And the effect of these drugs are very detrimental, no, to the life and growth of the fetus inside the womb. Okay? So, yan. So, meron din tayong tinatawag na retinoic acid or vitamin A derivatives are extremely teratogenic in humans. Even at very low doses, oral medications such as isotretinoin used in the treatment of acne, kayang maba, very beauty conscious ba? Animax. Hey, no? Very makipagkompetensya rin sa ako Okay. Very conscious siya sa growing acne, buto-buto na ang iyang mga pimple. Iyang butangan o mga tambal, bawal po yan guys ha, kasi it's a form also of medication. Okay? Potent teratogens yan. Okay? The critical period of exposures appears to be from the 2nd to the 5th week of gestation. The most common malformation include craniofacial dysmorphisms, no? Na ay deformity ang iyahang ulo and iyang nawong. Then it can cause cleft palate or lip, no? And neural tube, yung outpouching, yung spina bifida, pwede siya makakause yan. Pampabeauty lang man ni ma'am, uy, outside. Kaya nga no, blood vessels diya sa tumoy sa imong skin. Naa, di ba? So it can readily absorb the medication. The blood vessels na tinuringan yan, so it goes to a channel, no? So maapektuhan at maapektuhan pa rin ang mga buntis. Okay, kani siya guys. The tranquilizer thalidomide. So it is not used already now and kasi nakita talaga nila yung effect nito towards the unborn fetus, no? Is one of the most famous and notorious teratogens, no? As far way back 1959, no? So estimated 7,000 infants were born with thalidomide syndrome or meromelia. Why mga extremities guys? Ganahan ka imong baby na walay mga kamot, walay mga tiil, di ba? The characteristic features of this syndrome include limb abnormalities that span from absence of the limbs to rudimentary limbs to abnormally shorted limbs. Imbes na duha, na kay forearm, na kay arm, na kay forearm, karon ang kamot nimo, ang imong hen napilit na didto sa imuhang arm. Unsa na lang nandagway nimo, mura nagpato, di ba? Pangit, no? Then additionally, thalidomide also causes malformation of other organs, including absence of the internal and external ears. Wa kay dalunggan. Pwede pa wa kay ilong, no? Ayo lang pud nang way mata, no? Kaluoy na jud. Hemangiomas, congenital heart disease, and congenital urinary tract malformation. So there are babies also that has problems with their urinary tract and they do not have any urethra or to drain, no? Or to drain their urine. That is why they are being attached to catheter, urobump, no? From the urinary bladder down to the urobump, no? Artificial tube na lang, no? Just to facilitate excretion of urine. Okay, the critical period of exposure appears to be 24 to 36 days after fertilization. Kaya nga guys, no? 1 month and 6 days. So, hindi natin talaga yung mga women na hindi nila akalain na buntis sila. So, and then they undergo thalidomide therapy. No? It is a form of tranquilizer, mga good. Okay? So, pag sinabi mong tranquilizer, merong problema psychologically, no? Ang mga babae. So, to show you the effect of it, so these are sample of thalidomide children. Okay? So, wala po ito siyang mga paa, shortened din ang kanyang limbs sa upper extremity. So, mura silang robot, himuan na lang silang mga prosthesis. Okay? So, ito siya, wala talaga siyang upper extremity. Meron siyang lower extremity. So, isa lang yan, thalidomide ang problema. Because there is one particular time sa kanila na uso ang thalidomide because the women are experiencing depression. No? Depression. Okay. Then, next would be our infectious agents. This can also cause a variety of birth defects and mental retardation when they cross the placenta and enter the fetal bloodstream. Particularly, this what we call German measles. Yung 3 days na measles. Alright? 3 days lang yan. Pero, ang effect niyan towards a pregnant woman to the unborn baby is very detrimental. Why? It can cause cataracts, cardiac malformation, and of course, bungol imong baby. So there is no baby that has no defect in a mother who experienced, in a pregnant mother who experienced German measles during pregnancy. Okay? So meron talagang defect yung baby. So, ang ano nga ang mga doctor outside, even if it is already on the second trimester of pregnancy, they would still advise for the baby to be terminated. Kumbaga, the mother would undergo abortion. No? Kasi sabi ng mga doctors doon, no, because they are practical doctors na tinatawag, na sabi nila na how would you attend to your baby if you are working? This would become a menace in the community later on. No? So it would become a problem, not only sa mother, but also all members of the family. Ganyan. Yan yung mga prinsipyo nila. Now, why would you want a baby that is born abnormally? Well, you have a choice to eliminate it for as long as it is still inside your womb. You will do something about it, or you will born, no? Or you will give birth to a baby that has a defect. So it's your choice. So, yun. Kaya, ang tawag niya, legal ang abortion sa labas, guys. Because they don't want to produce any abnormal kids, no? Or would become a liability later on ng community. Okay? Then also another one would be congenital cytomegalovirus. This is an infection, viral infection of the fetus. Okay, infection of the early embryo during the first trimester most commonly results in spontaneous termination. So exposure later in the pregnancy results in intrauterine growth retardation. So mahimong punggok ang pagtubo sa baby. Sometimes we call it small for gestational age. No, maliit siya sa kanyang edad. Kumbaga. No? Then chorioretinitis. The eyes will be affected. Walay swerte, buta ang imong baby, blind. Okay, microcephaly, gamay, ug ulo. Then cerebral calcifications, mental retardation, and so on. Hepatosplenomegaly. Okay, those are vascular organs that is very bloody, kumbaga. Ang liver is highly vascular. Storage po siya sa atuang red blood cells. While our spleen naman is also bloody. It stores also RBC there. It has its own benefit, no, sa ating body. Okay. So we go now to the ionizing radiation. That is why during yearly or annual, no, checkup, laboratory and diagnostic checkup, the technician would always ask, are you pregnant, before you are exposed to radiation, because it has a detrimental effect if their baby is still in the first trimester of pregnancy. Even nga kung nasa second or third trimester of pregnancy, they will not get any x-ray from a pregnant mom. Kaya alam nila mismo yung mga ating mga radiotherapy department na it has really an effect on the unborn child. So they don't want to be a cause, no, why you have a congenital malformed baby, no? Yan. Then we go now to what you call this one, maternal medical conditions such as your diabetes. Kasi kung mataas ang sugar level mo sa dugo mo, your blood flow is very slow. There is sluggishness of flows sa blood mo, sa blood vessels mo. So definitely, if this would happen, it can cause blockage on some other areas because of the thickness, no, ng iyong dugo. So, pwede din siyang maging a problem in the distribution of nutrients and blood to the unborn child. So that is why ang mga gamot din ng mga diabetic mom is also teratogenic to the unborn fetus. Okay? And of course, increase din ang chance ng baby to have congenital heart problem later on, renal, gastrointestinal, all the major organs in the body, no? Because ang effect niya is grave, kumbaga. No? So, bawal talaga maging diabetic and then you plan to get pregnant. You treat yourself first, no? Mom, what if it's genetic? It really runs in the family. Yes, of course. Lifestyle change can lower your risk from acquiring the illness. But there are cases really, if it is found in the genes, no? It will appear during your unpregnant state ba in life, wala jud kay increase in your sugar level. But when you get pregnant, you experience the surge in the increased sugar level in your body, because the hormones of a pregnant mom has got to do with that. There is an interplay, no? Ang hormones ng pregnancy would make the sugar level in the blood undetected. That is why insulin will not be produced by the pancreas sa pregnant mama. Okay? So, tinatago kumbaga ng hormones yung increase in the sugar level kasi they wanted to supply the mom with lots of it because the mom is pregnant. Okay? Particularly our hormone progesterone. No? It is much increased than estrogen during pregnancy. Okay? Yan. So, very difficult good to have. No? If there is tight glycemic control during the 3rd to 6th week post-conception, that is very critical. Okay? Infants of mothers with phenylketonuria who are not well controlled and have high levels of phenylalanine have a significant risk of mental retardation. So, would you want the waste products to go to the brain of the baby inside the womb? We don't want that to happen. So, dapat controlled ang sugar level ni mama. Okay? Yan. Prone din ang mama sa congenital heart disease at this point. Okay, so there is what we call also mechanical forces that can really affect, no, pregnant mom. This is considered also as teratogens, no? So malformations of the uterus may restrict fetal movements and be associated with congenital dislocation of the hip and club foot. Okay? Then oligohydramnios can have similar results and mechanically induce abnormalities of the fetal lips. These oligohydramnios are mothers that produces low, no? Low amniotic fluid index. Konti lang talaga yung kanilang amniotic fluid sa uterus nila. So kung konti lang, easily na kunyari mayroong application of pressure sa abdomen. So, ang atong amniotic fluid is one that protects the baby inside the womb. Kung depleted ka nun, diretso sa baby yung force na mangyari. Like accidents, no? Like in the picture, no? Ang seatbelt ni mama hindi po pwede ilalagay dito on top of the abdomen. It is across the chest and below the abdomen of the mom. No pressure should be allowed to be applied, no, over the abdomen area. So this can cause mechanical forces, malformations on the part of the baby inside the womb. Okay? Okay. So, ug mapisat ang abdomen ni mama, naigo ang ulo ni baby. So we can, tapos si baby nag-survive, tapos nagkaroon siya, natamaan ng kanyang muka, so pwede siya magkakaroon ng what? Malay natin, nasugatan siya. Then, nag-separate ang kanyang lips. Pwede ganon. It is due to mechanical forces. Okay? Yan. Then also, what we also have what we call amniotic bonds, no? These are fibrous rings and cause intrauterine amputations or malformation of the limbs as well. So as you can see in the picture, meron siyang nagsiwil na mga amniotic bonds, no? Para siyang mga strings na ni-release ng ano ba ito? Chorion, no? Yung that is the outer layer of the amnion pala guys, sorry. Amnion, no? The outer layer of the amniotic sac. Okay? So rare lang po ito from occurring, but walay swerte kung matungnan. All right? So this can go around the foot, around the fingers, no? O way swerte, tibuok niyang duha ka tiil natalian sa amniotic bands. So this can cause what you call amputations or malformation of the limbs ng baby. Okay? So yan. Then we also have what we call multifactorial inheritance. So kagaya ng sabi ko kanina na pwede din siyang cleft lip or cleft palate lang or pwede din siyang both na mangyari. And this outpouching of your spine, no? Itong blue dito, amniotic cerebrospinal fluid yan. And this yellow is the cord, no? Spinal cord, no? If it is not treated or hindi siya maagapan, it can cause paralysis of the lower limb ng baby as the baby grows. And also, walay swerte, nagkaroon ka ngayon ng baby na walang scalp or walang skull, I mean. Walang skull to protect the brain. So the baby cannot survive, no, for 24 hours. The baby might die. Then, ito naman po is yung encephalocele. So yung outpouching niya is nasa ulo niya. Sometimes they would put shunt on this one to drain the excess cerebrospinal fluid, which can cause a lot of pressure later on, which can cause also yung problems sa baby, mga shrieking cry niya, no? Syempre, hindi comfortable si baby. Buti pa itong spina bifida, guys. Pwede pa siya na, even if the baby is paralyzed down, waist down, but the baby is really normally functioning. Okay? Yan, may mga question siguro din eh. It is the prerogative po ng doctor, no, to expose the mom for X-ray. But if kung pwede lang naman na wala, mag-undergo muna si mama ng antibiotic therapy that is meant for pregnant mom na wala namang teratogenic effect. So mag-undergo muna sila ng diagnostic naman gud diyang X-ray if it is really not needed. So why expose the pregnant mom? Kasi alam naman natin na meron siyang teratogenic effect. So sometimes kung ano talaga, it is the doctor's choice, and of course with consent from the pregnant mom, despite of the explanation of its effect. So it is much more important, iwi-weigh man gud nila if the risk outweigh the benefit, hindi na nila gawin. If the benefit outweighs the risk, so pwede gawin ang diagnostic procedure. Titingnan muna yan nila. Pag ang mother is in the first trimester of pregnancy, yung organogenesis, definitely the mother will not be submitted for X-ray. But if the baby is on the second trimester of pregnancy onwards, most probably it is the choice, no, ng doctor, obstetrician, and the mother. But definitely yung mga nalaman ko na mga mother that has respiratory problems, antibiotic therapy lang muna sila. Kasi mas teratogenic po ang radiation sa mga pregnant mom. Okay? So, ano pa yung question din eh? Okay, wait ha. Tatlo yun eh. Ay, mali. Wait. Ma'am, what if accidental po sila nakadrink while pregnant? Yang di pa po nila alam na pregnant sila, kaya nakainom po ng alcohol. Malala na po ang effect niya sa baby, ma'am. No. Okay, it's like this. If the mother doesn't know that she's pregnant, inahubog yun siya to the max level nga nahubog, most probably meron talaga yung effect because alcohol runs in your system as well as the system of the baby. So you would, the baby would experience drowsiness as you experience it while you are intoxicated with alcohol. So there is already an effect on the baby. Yan lang yung masabi ko dyan. So further assessment will be required. Nung nalaman mo pala na buntis ka, musiga na lang imong mata. Okay? Okay? So yun. So we are done with this particular slide, and it is 2 minutes to 7 p.m. Okay, so